all about. So without much further ado, I want to talk to you about what's happening today. And interestingly, Google tells us that vitamin D is trending. Well, everything that trends these days trends for the same reason, it seems like. COVID, right? So everyone's sick of COVID, but we can't stop paying attention to it. And today's no exception. Today, February 8th, another publication, Vitamin D can assist COVID-19 patients to avert major sickness. Israeli report. Very interesting because vitamin D is a really big deal in the bone and joint world. And so kind of odd that it would be popping up in something totally unrelated, seemingly unrelated, COVID-19. So my first thought is, what in the world's going on here? Why is a hormone, because vitamin D, the way it affects our bodies, it's essentially a hormone. Why is this hormone affecting COVID? I mean, it just doesn't really make sense. And interesting, so let's, first of all, like anything else, we want to know, is this true? Well, excuse me. In a study, conducted recently, a group of Israeli scientists claim to have accumulated the strongest evidence to date that attempts to prove higher vitamin D levels can assist COVID-19 patients. This did come out earlier in the pandemic, and Israel has a super organized electronic medical record system, and so they kind of knew who was getting COVID and who was on vitamin D, and they noticed early on that people on vitamin D seemed less likely to get severe or be hospitalized with COVID. So this is another publication. This is Thursday in the journal PLOS 1, PLOS 1. I'd never heard of that. So I looked it up. The first thing, one of the best indications if a study is credible or not is it published in a credible journal? The reverse is not true. Not every credible study is published in a credible journal. But at least if it is in a credible journal, you have a pretty good sense that some credible people, talented people have reviewed it and thought it was worth telling you about. So PLOS One, it turns out, is a journal that's trying to get things to the public quickly. It's a little bit hinky. Like if you look at there's a lot of social justice and science stuff, and social justice is important and science is important, but combining the two often kind of raises my concerns a little bit. Are we interested in more in social justice or more in science, and how do we reconcile? So there's a whole lot going on there. It doesn't mean either one is bad, but just sort of makes you wonder. So who are these editors who are reviewing studies quickly? Emily Chenette, editor-in-chief. She looks very nice photo here. Oh, okay, biochemistry at Columbia. Heard of Columbia, great place. Got her PhD at the University of North Carolina at Chapel Hill. Big science. Went to Duke, nice. Analyzed gene expression in lung cancer. All right, so clearly credible scientist. Has position in Nature Cell Biology, Nature internationally prominent molecular biology journal, cell biology journal. George Wuston, he's the deputy editor-in-chief, and he similarly looks like he got a doctorate at Cambridge. Impressive. Michelle Drum, lots of impressive people. A lot of young people, which is good, because you figure young people know where it's at, working hard, getting the information out there. But so interesting. PLOS One, this is not some crackpot thing by any means. These are credible people. They may or may not have an agenda that could be influencing stuff, but I don't see how it would influence COVID. So it seems credible. All right, very good. So we've got this fact that, who's this guy? This is interesting because on the one hand, This is Dr. Brian Hollenbeck, some TV channel in Boston. This guy's testifying about it's kind of interpreting the results for us. Kind of a weird picture, right? Because on the one hand, he looks surprised, and you can see the edges of these worry lines. He's worried about something, but not in the middle of his forehead, only up toward the edges. And then looks like probably he's got a kid. I mean, he's got like no sleep. And I don't know what's going on, or what this office that looks like it's got some diplomas in the back of the office in a Circle K or something. I don't know what's going on here. But anyway, this guy's not going to help us much. Well, okay, what's going on here? We've got what seems like a good journal saying that vitamin D deficiency protects you in some way, or vitamin D protects you against COVID, so it has some kind of immune function. And here we are, musculoskeletal, live free of spine and joint pain, live free of spine and joint pain. What's this got to do with each other? Well, vitamin D deficiency has a lot to do with spine and joint issues. This is Cleveland Clinic's website. They have a very nice infographic about things that if you are deficient of vitamin D, things that you might notice. You might have mood changes, anxiety, a lot of different things. So there's some kind of emotional effect. Bone loss, osteoporosis, the thinning of the bones. Our bones build up until our early to mid-20s, and then they start getting thinner. And if you don't have enough calcium, then they get thinner faster, so you're more likely to get osteoporosis. And what controls the amount of calcium in your body? Your hormone vitamin D. So vitamin D heavily involved in that. It's more than that, though. If you don't have vitamin D, you get cramps in your muscles. Same kind of cramps people complain about when they're dehydrated. Like the muscle's just not working right. And we know that calcium and phosphate, two things that vitamin D is involved in regulating, have a lot to do with the way that muscles normally function. So not having enough vitamin D means not having enough muscle function. Bone and joint pain, especially back pain. That's how I actually got interested in this. Back in my neurosurgical days, we noticed that people with chronic pain were very often vitamin D deficient. In fact, when vitamin D started becoming something people were talking about, as a doctor, I started checking my patients' levels. Every single patient was abnormal. Honestly, it got to the point where I just thought, why check it? Just take vitamin D. It's not going to hurt you as long as you don't take too much. There is a hypervitaminosis. It's a fat-soluble vitamin, so you can take too much. So you got to be a little bit careful. But I was stunned at how many people had, because I was seeing people with spine problems and chronic pain and fatigue. That also mood changes. This gets into our emotional state and our CNS. So very interesting. A lot of spine and joint stuff. Vitamin D is also interesting in another way. The great Billy Paul. You know who else has got a thing going on? Vitamin D and rheumatoid arthritis. There's been this really weird association between vitamin D and rheumatoid arthritis, which has been kind of kicking around for a number of years. This was a study in a great journal, Therapeutic Advances in Endocrinological Metabolism. It's not like People magazine, right? But great journals, credible scientific journal. And they looked at people with rheumatoid arthritis and people without rheumatoid arthritis. So the people with rheumatoid arthritis are the subjects that they're looking at, and the people without it are the controls. And then they measured their vitamin D levels. Look at this. This is the level of vitamin D3 in people with rheumatoid arthritis, and this is the level of vitamin D3 in a matched control group. So in this kind of thing, the circle is the average or the mean, and then the bars are the standard deviation. So if you took everybody without rheumatoid arthritis, this was their average vitamin D level. This was the lowest one, and this was the highest one. But nobody, then there was this huge empty area, and then here's our rheumatoid arthritis patients. So there's this huge association. People with rheumatoid arthritis have way, way, way lower vitamin D than people without it. Does that mean that vitamin D causes rheumatoid arthritis? No, right? It could, but it doesn't prove it. What if it's just an association? Okay, so people with rheumatoid arthritis have a harder time getting out to their pool and laying in the sun, and sun exposure is what causes our body to synthesize vitamin D. So vitamin D could have some completely tangential or associated thing that it does, but it's definitely interesting, right? These two guys live in the same neighborhood. There's something going on. There's something going on as Mr. Jones between like Mrs. Jones. There's something going on. Very, very interesting. Well, here's something else that's I think is interesting, and this is a graph from a credible paper that looks at the effects of vitamin D, the hormone. So here's our vitamin D, and here it's binding, getting in the blood and binding to cells. Vitamin D are these little Aztec star looking guys. Here it's binding to a cell, and it's causing changes in transcription, changes in the way that DNA is transcribed in the nucleus of the cell. The target genes, and this has of course been studied very carefully, the target genes are listed here, and here's some of the cells that it affects. Holy cow, the macrophage. These guys are in our blood, they're the scavenger cells. They're looking for foreign stuff, infection, COVID, right? So maybe by activating these macrophages and also the adaptive immune system, T helper cells activated, T and B lymphocytes. So not surprising that there's something going on with COVID and immunity with vitamin D, right? We're in that neighborhood of cells that respond to infection and inflammation. More and more though, especially if you are on this channel, you know that inflammation is the actor that's responsible for a lot of our joint pain. It's inflammation that's caused by a herniated disc onto a nerve root that causes radiculopathy. It's inflammation of cartilage that's open and causing an inflammatory reaction and grinding bone on bone. It's inflammation inside the joint that's causing arthritic joint pain. So there's inflammation, and look at some of these things. The MHC2, look at this guy, the COX-2. COX-2, remember our good friend Celebrex in the immune cascade, the COX-2 antagonist. So an anti-inflammatory drug is affecting the same gene that this vitamin D is affecting. So really super interesting to me. We're kind of getting into what's going on. As a matter of fact, it's been a long time that people kind of said, hey, a lot of people have vitamin D deficiency. In fact, if you just go grab a random hundo of folks, about 40 of them, about 40%, are likely to be vitamin D deficient. I told you in my clinic, it was 100%. Everybody I checked, everybody with chronic pain. If you did those rheumatoid arthritis patients, you would have found the same thing, right? All those people in that graph had vitamin D serum deficiency. There's also a ton of people with joint pain. So, wait a minute. We got a ton of people with vitamin D deficiency. We got a ton of people with joint pain. Could we know vitamin D affects bone and joint health? So could vitamin D deficiency be the source of all the joint pain? And in addition, could we use vitamin D like a drug? Could we use this hormonal molecule like a drug to actually treat joint pain? This is where it starts getting interesting, right? Because we start saying, oh, wow, I could just take some vitamin D and make my knee pain go away. Not so fast. So studies started coming out over the last 10 or maybe even 15 years where they would do these kind of things. Okay, here's a bunch of people with knee pain. We gave them all a ton of vitamin D, and it was super fuzzy. Some studies showed, wow, the patients were way better. Their x-rays didn't look better, but they were they reported being better. Others showed other things, and so it became really hard. When that's the case, you can't look at one study and say, oh, it's A. Because one study did show A, but another study showed B, and a third one was C and D and E and G. So you can't look at it that way. We need a tool to combine these studies and say, okay, there's obviously something wrong with each individual study because they're showing separate things. So can we get to the right answer by combining them all? And that, my friends, is called a meta-analysis. The combination of studies to analyze the results. The mathematics behind that is called meta-analysis. Very, very helpful. So the way you do a meta-analysis, you put together all the studies you can find, the effects of vitamin D supplementation on knee osteoarthritis. A meta-analysis of randomized controlled trials. Ooh, sweetness. Randomized controlled trial means we didn't just look like they did, here's a bunch of people with rheumatoid arthritis, and here's a bunch of people, what are they like? No. We came up with a protocol. We're going to take everybody with knee pain who has these inclusion characteristics. We're going to get rid of all the people we don't think we want to study for this thing. They have exclusion criteria. Of this population that's left, we're going to flip a coin and say, you get vitamin D, you don't. And then we're going to compare their knee pain with some measurement. Well, what's the measurement? Oh, okay. The measurement in this case was WOMAC, W-O-M-A-C, which is the Western Ontario McMaster University Arthritis Index. Western Ontario McMaster Arthritis Index. I don't know why index has a C, but that's what WOMAC is in this study. So Western Ontario, so we're in Canada. Okay. And they've come up with this thing they're going to follow, which is this survey, the WOMAC. Results, 1,136 patients. It's a good number, right? We're not talking about 15 people at a birthday party. We're talking about 1,136 people. And what they found, vitamin D supplementation was effective in improving the WOMAC pain and function in patients with knee osteoarthritis. All right, that's good to know. So in other words, people reported feeling better. And, these people were also on a control. So it was randomized control. So some people got placebo, other people got the pill, but the pill made them report. People who got the actual vitamin D3 at 2,000 international units a day were happier with their knee. However, it had no beneficial effect. It had no beneficial effect on the prevention of tibial cartilage loss, which they knew by doing x-rays. So they concluded there is currently a lack of evidence to support the use of vitamin D supplementation in preventing the progression of knee osteoarthritis. All right, so the meta-analysis showed people actually were happier. They felt a little better on their WOMAC score, but their x-rays didn't change. So yeah, it wasn't a cure-all, but they felt better. The study makes it sound the effect of vitamin D like maybe you wouldn't want to take it, but I mean I don't care. I don't expect to be 10 years younger from taking some vitamin D. I just want to feel better. So I don't know. That to me is encouraging, and at least it tells you you don't want to be low, right? People felt better, and we know it is tied to bone and joint health, so we don't want to be low. What about in spine? Is vitamin D supplementation effective for low back pain? A systematic review and meta-analysis. This is the journal Pain Physician, which is not the best journal, but not the worst. And it's in March of 2018, so it's a few years old. But yeah, it's been a minute, but it's not that out of date. It's recent. And they looked at meta-analysis with vitamin D. Seems like they knew what they were doing. They screened 3,534 articles, and they found 8 clinical trials. Okay, so not too many, but they found some. Conclusions: vitamin D supplementation is not more effective than placebo. No intervention or other conservative interventions in low back pain Very low quality evidence. All right. So no real effect on back pain. Not surprising. It takes a lot to affect chronic low back pain. Not surprising. Well, I think though, what I would conclude from this is, first of all, there's something going on here. The knee people were better. It kind of fits. We've now got evidence that vitamin D is so immune modulatory. It even affects your responsiveness to COVID. So there's something going on here. I think it's safe to conclude that you don't want to be low, right? Okay, there's a good randomized controlled trial. It's not going to eliminate my back pain. It's not going to change my x-ray, but at least I don't want to shoot myself in the foot either and be low. Because clearly, rheumatoid arthritis, people don't have it. Chronic back, there's stuff going on here. So don't be dumb, right? We may not be able to help ourselves that much, but let's not do anything that's going to make ourselves worse. So let's make sure we have a normal level. So how do we get to a normal level of vitamin D? And the answer is you measure it. Right? Vitamin D level is something you can measure in a blood test. So if you have a primary care doctor, ask your primary care doctor to test you. If you don't have a primary care doctor, then you can just, these days in Arizona, you can go to a lab and you don't need a doctor's prescription. So I don't know where you are. You can try by just going to a lab or urgent care or find somebody you know or do something, but find out your vitamin D level. There's this huge controversy over what is a normal vitamin D level. And quite frankly, I think it's kind of beneath us. Who cares what this is laboratory science nerdology, Get the blood test. If the lab you're being tested in says you're low, then consider yourself low and do something to get higher. If the lab says you're normal, then don't worry about it. You're normal. Test yourself next year. Enjoy a healthy lifestyle. So, nothing to get too excited about. If you are low or if you're on the low side, then, whole foods are always best. We've talked about this before. And there are foods like oily fish, cheeses, eggs, feta, these are beans, very rich in all these foods are very rich in vitamin D. Milk, cheese, all these foods are very rich in vitamin D. And what's interesting, remember our 5 steps to reduce joint pain? There's a lot of crossover here, right? We've got the oily fish, a lot of things that are good for you, no milk and no dairy over here, but there's some combined and similar elements. Those beans, I'm getting kind of an anti-inflammatory vibe out of these vitamin D foods, so that's good. You can also take vitamin D to supplement. I mean, that's just a fact. And then you get into the whole, well, which medication is best? And, there's a lot of different answers to that question. I think the best way is to just go ahead and find, as usual, if your level is low and you're raising it up and you're going to follow it with your blood work, then you want to take a supplement that's made in a laboratory that has some kind of external validation. Ideally, in America, it's a lab that meets the standards of the FDA, the Food and Drug Administration. But at least you want to know that somebody is rating them. There's some kind of standard that they're following, and do your best and take it. And if it doesn't go up, then take some more. And if it doesn't go up, then talk to your doctor. And maybe they can help you recommend something that would be better. Well, that's it for today, Tuesday. I hope you got a belly full of interesting information about vitamin D. Hey, come on, subscribe. Do you want to live free of joint pain? Come on, subscribe to the channel. We'll hit notification. And we're going to let YouTube's going to notify you when we have new content. We're going to give you all the information you need to live free of spine and joint pain, whether that's what you eat or I hope you don't have specific joint problems from arthritis or injury or whatever, but if you do, we want you to know how to deal with those. Take care of it, get better, and move on. Have a great day. and I'll be back in touch with you soon.